Hi, so today we are going to discuss regarding modern newborn care. Um, we have seen in a last video this, but due to some reason I won't able to continue the making videos. So we will just see what is that, and we will continue. Right. So there are we have seen that there are three types of newborn care based on most clinical scenario after the birth. After the birth, on a clinical basis of scenario, there are three types of newborn care, right? So which are those? We will see. We will see that first is a routine care, right? So first is what? First is a routine care. We have seen it already. First is a routine care. First is a routine care, right? Second is observational care, and third is a post resuscitation care, right? So we have seen it already. We will just take it what is we will just revise it. Routine care. Routine care means what? For normal delivered baby required no assistant to get stable after the birth. After the normal delivery, the baby will not require any kind of a assistant, so that could be called as a routine care, right? So next is the observational care. What is observation? Some kind of observation we are needed after the baby is delivered, right? So for the baby delivered, for baby with a delivered with a complication, why need we observation? Because the baby is born already, baby is born with some complications, so he may require some kind of assistant to for what? To get stable after the birth, right? So after for getting stable, he needs a kind of a assistance, right? So next is what then? Next is a post observational care, post resuscitation care. For a baby delivered with the complications during the labor required resuscitation. We have seen what is a resuscitation? To taking the baby to its normal form. What taking him to the normalization, making normalize, right? So that is called resuscitation, right? So we have seen that three types has been given for routine care, observational care, and post resuscitational care. Three types we have already discussed this, so we will move to the next slide. Right, we have till seen. First we have already seen the routine care, so we will start with the observational care. So what is observational care? We will see it in a detail form, right? So observational care we will start. So observe what is observational care? Ah, observational care in a neonatal management. So what is observational care? Newborn requiring a neonatal resuscitation and necessitates vigilant observational care. He requires vigilant observation care. In addition to what? Routine care practices. In addition with routine care practices, continuous monitoring, vital signs are essential. So it is become very important to get routine care practices with along with the continuous monitoring and vital signs is essential. This include what? This include close observational respiratory efforts, heart rate, overall activities, etc. All will be included under the observational care, right? So what is breastfeeding should be commercial only after the babies gets deemed physiologically get stable. These kinds of observational care is necessity for what? Or what we will see in that. So we see smooth effortless respiration at the rate of the 40 to 60 per minute, a heart rate between what? 100 to 140 per minute, and active state accompanied by a strong cry or effective sucking reflex. These kinds of things we have to see in that, right? So our regular efforts of a passage of a urine and stool, etc., we have to see in clinical form, right? So next is what? Next they have given post resuscitation care. So what is a post resuscitation care? We have seen two, and this is the last among this part. So what is a post resuscitation care? We will see it, right? So post-resuscitation care. So what is the post-resuscitation care? Post-resuscitation care should be provided to newborn who require aggressive neonatal resuscitation, or the child which is born with the complications. So this particularly required to the childs who have born with the complications. Those require post-resuscitation care, right? Including what? Adequate oxygenation. We have to provide adequate oxygenations with what? We can insert AT tube. There is a endotracheal tube. We can even use ET tube, right? Endotracheal tube we will use, right? For ventilations, we have required ventilation, circulations, continuous monitoring of a newborn. This is also very important. Continuous monitoring of the newborn is essential until the cardiopulmonary stabilization, cardio and pulmonary system until get stabilized or get achieve stability. We have to give continuous observation or resuscitation care to the baby, right? Once the newborn gets stable, breastfeeding can be initiated. When the baby's physiology become normal, we can continue give him breastfeeding, right? So these kinds of things we have to remember, right? After they have given, nutrition should be introduced progressively. So nutrition is very important, but given when introduced progressively, not suddenly, based on the baby's condition, how's the baby behaves, accordingly that we have to give or provide the nutrition. So first is the intravenous fluid. Critically ill newborns, for the babies who are critically ill, we have to intravenous fluids like IV, IM, we can provide him DNS, RS, um, that this RLS, and that is ringer's lactate, RL, वगैरह DNS, etc. things we will provide to the baby. So feeding by Ryle tube, we have to Ryle or rice tube. We will got difficult to breathing, for those baby who get difficulty with the breathing and sucking, so we can provide food feeding through Ryle's tube, right? So next is the spoon feeding. We can give milk through spoon and breastfeeding, etc. things we will be breastfeeding after the baby get stabilized. So we have seen three most important types of the how we have to take care of the baby, right? So next we will see care and preterms of the baby. What kinds of preterms we are used, we will see that.